right, I'm going to get started. Well, thank you so much for everyone for joining. Um, my name is Jun Kim. I'm the founder and CEO of Med School Mentor, and our mission is to empower the next generation of healthcare leaders through mentorship, community, and conversation like this webinar we're having today. I'm joined by our incredible panelists here, Dr. Chandra, our Chief Academic Officer, Dr. Borges, our Executive Director of Global Outreach, and Camila, our communications coordinator. Today marks a special moment as we continue our Leaders in Medicine webinar with a guest who truly embodies the spirit of leadership, mentorship, and innovation, Dr. Michael Lim. Dr. Lim is chair of neurosurgery at Stanford and an internationally recognized neurosurgeon-scientist. His bibliography includes well over 300 articles on topics such as GBM immunotherapy, stereotactic radiation for glioma, and neuropathic pain treatments. His research has been featured in top-tier journals like Nature Medicine, Science, Nature Immunology, Lancet Oncology, and Clinical Cancer Research, along with over 20 book chapters and monographs. He has delivered platform presentations around the world, including American Society of Clinical Oncologists, American Academy of Neurological Surgeons, Congress of Neurological Surgeons, and other meetings, really shaping the future of brain tumor therapy and surgical innovation. But really, our goal with this webinar goes beyond clinical titles and accolades. Through this webinar, we want to get to know the leader, Dr. Lim, the once mentee, Dr. Lim, and now, I'm sure, the mentor for many, Dr. Lim. Dr. Lim, thank you so much for being here with us today. We're really grateful for the opportunity to learn from you today. Your career is really an embodiment of what we represent at Med School Mentor, creating a space where future leaders in medicine can learn from those who paved the way. And I believe you have a presentation prepared for us. Feel free to share your screen, and the stage is yours.
Great. Thank you, June, for that very kind invitation. It's my honor to be here today and to talk to you a little bit about my life experience. Can you see my window?
Yes, we can.
People can see my talk. Okay, great. All right. So I titled my talk today, Career as a Journey. Okay. And this is my relevant disclosures. Um, so I want to start the talk today saying that if you look at your life, and as many of you are med students about to embark on an exciting career, it's a journey. And it may seem like you have this path that's straight ahead because you're going to, for those of you who are in medical school, you know that you're going to get into residency and then a fellowship maybe, and then go into becoming an attending. But I think that oftentimes we've been programmed to just think about what's next. That I always say you want to take advantage of what's happening now to try to really, I guess what I would say is give you the necessary skills to help you for the future. When I started my career, I actually started at the University of New Hampshire in college and studied starfish. And at that time, I knew that I wanted to do research. And I actually worked in a lab where we studied not only starfish, but clams with leukemia. And I was learning about pathways such as P53 and c-Myc and retinoblastoma, which was a very hot topic back then. But I learned skills in molecular biology. And after graduating from the University of New Hampshire, I went to medical school at Hopkins, where I again was able to spend some time in the laboratory of someone named Jonathan Simons, and then was fortunate enough to do a year of research, and then uh, again studying cancer. And I was particularly interested in cancer vaccines at the time. When I finished medical school, I wanted to go to a residency that was not only going to give me a fantastic surgical experience, but also um, a place where I could learn more about science or have a learn about scientific processes. And I went to Stanford for 7 years and again had a fantastic experience learning about actually angiogenesis at the time. And then after I finished residency, Dr. Henry Brem, who's on this picture, offered me a job to come back to Hopkins. And to me, this was a very neat pic. This is a momentous picture for me because it's Dr. Brem having me sign the contract in a special library at Hopkins. Um, and in that, when I was signing that, I was going to get to live my dream as a physician scientist. And that was what I wanted to be, a clinician scientist studying cancer. And throughout my years there, I was very fortunate enough to have a very robust clinical practice. I had a very busy practice taking care of patients with brain tumors and trigeminal neuralgia, and I was able to have a lab and build a lab. And um, it was for me a dream to be able to go and live this career. And so what I remember sitting at that table with Dr. Brahma, and I had negotiated protected time. I had a lab, I had equipment, and I had personnel to start my career. But what's interesting is when you start as a physician or a physician scientist and you start your career, um, it was kind of this moment of now what? I don't know if you've seen the movie Finding Nemo, but these fish spent their entire life or entire episode of that movie trying to figure out how to get an escape from an aquarium in a dentist's office. And now that they escaped and they're sitting out there, they're all saying, now what? And in some ways, I think when you start your career as a clinician scientist, it is a moment where you're treading water and you say, now what? And for the first few years, I was trying to figure out my way. I was writing uh, a lot of grants and I was looking at different pathways. I was reading a lot. I thought that Th17 or IL-23 was going to be an important pathway. STAT3 was going to be an important pathway. And we published some papers. But what I learned is that um, you have to have a vision first. And when I came back, I really said, okay, what do I want to accomplish? And I wanted to have a brain tumor immunotherapy program. And in the brain tumor immunotherapy program, I envisioned having a component of basic science, clinical trials, and translational science. And they're all supposed to move back and forth. And with that, I thought that we could make an impact or try to be able to move the field forward. So as I mentioned before, I focused more on the basic science in the beginning, and I had treaded water trying to study those different topics. But one of the things that I think is so great about being a clinician scientist is that you get to be in the trenches. You get to take care of patients, and you get to see the disease from a very close perspective. But also, you work in a community, and as an example. Uh, this is a patient that came in to see me in my clinic, and he was referred to me by one of the oncologists at Hopkins, and he had a solitary brain metastasis. And it was a brain metastasis from something called renal cell carcinoma. And at that time, he was on a clinical trial of a drug. I didn't even know the name of it. It was called MDX 110. And I remember knowing that I remember recommending surgery for the gentleman because he had a great performance status, and with a solitary metastasis, you can improve survival for these patients. And I took him to the operating room. And when I took out his tumor, if you look at the H&E and the CD8 stains, um, it showed that there was no tumor. There were no tumors in this in that specimen, but they were all inflammatory cells. And I remember being very fascinated by this patient. And it turned out that he had a complete response over the ensuing 6 months. He had metastases to his lungs, he had metastases to his adrenal gland, and whatever drug that he was on was working miraculously. And it turned out that drug, MDX-110, was actually acquired from the company I was making. It was called Medarex, was acquired by Bristol Myers Squibb, and it's a drug called Opdivo, or some of you know the other competitor's name is Keytruda. It's anti-PD-1, and it's a checkpoint inhibitor. And this drug works on the second signal after a T cell engages its cognate antigen. And the second signal either turns the T cells on or off. And cancer cells turn T cells off to protect themselves. It's the same mechanism that's employed for preventing autoimmunity. However, if you disrupt the second signal, the T cells can activate and they can actually start killing cancer cells. So I realized that I saw one of the very first patients in the world treated with anti-PD-1. And over the ensuing years, I took care of more patients because my colleagues in melanoma were part of that trial, my colleagues in lung cancer were part of that trial. And as a result, we saw patients with large metastatic, large cancer burdens or multiple metastases having tremendous responses. And some of these patients were even cured. So, knowing this and seeing this, I said, well, we have this immunotherapy program. Maybe we can take and study this for glioblastoma. So, Jing Zhang, who was in my lab, and my mentor, Drew Pardoll and Chuck Drake, um, uh, were people I worked with, and we were able to get the anti-PD-1 antibody. And Jing Zhang actually showed very nicely that if you gave anti-PD-1, you could improve survival in these animals, and if you gave radiation, they did even better. And it turns out that you could even activate some of the immune cells. Having generated this preclinical data, we were paralleling what happened to patients with melanoma and lung cancer. And we said, okay, well, we need to get this drug into patients. We need to run a trial just like they're running for melanoma and lung cancer. And initially, um, the company said no back in 2010, 2011. And but then a year later, new people came into Bristol Myers Squibb. But I was crushed the first time they said no. And people like Vlad Korij, Karina Tate, and Robert Latek at Bristol Myers Squibb said, we've got to do this for glioblastoma patients. And so we started having conversations with Bristol Myers Squibb. And in 2013, they used the data from our lab as preclinical data, and they put together a working group. And I was very privileged to be included in that working group. There were several prominent institutions that were brought together, and we all met in New York. And I got to meet people like John Sampson and David Reardon, and they were great mentors for me. Because instead of going with a phase 1 trial, Bristol Myers Squibb said we're going to go for a phase 3 clinical trial. And with that, um, we then went and we finished our paper in 2012. In 2014 and 2015, they launched, Bristol Myers Squibb launched 3 phase 3 clinical trials, one in recurrent glioblastoma and 2 for newly diagnosed glioblastomas. One for the patients who have the methylated MGMT, and the second for the patients who had the unmethylated MGMT. Now, those trials took several years because it was a phase 3 trial. And through those years, we started seeing many different cancers getting FDA approval: melanoma, lung cancer, renal cell carcinoma, head and neck cancer. And we thought that this was going to work. And I was so excited to see this. But instead, the results came back negative for all 3 trials. And if you look, our last publication in 2022 um, showed that, again, the trials were negative. And we generated this data in 2012 for the animals, and it took 10 years to figure out to get this answer, even with the help of industry. Now, at that moment, of course, it was a big setback for all of us because we thought for sure we were going to be able to help people. And being a clinician scientist and being in the field of neuro-oncology, you have to have resilience and we have to go back and we have to ask, what could we have done better? And so, with that and that experience, we went back to the bench and we started looking for other targets. And it turns out that in glioblastoma, I mean, in many different cancers, actually, there are many different checkpoint molecules. And LAG3 was one of them that was highly expressed across many different GBMs. In fact, it's ubiquitously expressed in the infiltrating T cells of GBMs. And Dr. Peter Fecchi's lab, as well as our lab, showed that these T cells that were in glioblastoma were not only expressing LAG3, but they were also what they call exhausted, basically lacked the ability to kill cancer. So we thought that LAG3 might be a good target. And after looking at our patients and finding that this was ubiquitously expressed, we went back to the animals and tested this. And we showed that if you looked at the T cells in the animals, from the tumors in the animals, if they had LAG3 and PD-1 expression, these T cells were exhausted. And if they were not expressing LAG3 or PD-1, they actually had the ability to kill. And when we looked at again at the tumor specimens, you could see that the T cells or immune cells were expressing LAG3. So then this was work by Sarah Harris Bookman and Demetrius Mathios. When you treated the animals with anti-LAG3 and anti-PD-1, we saw improved survival. And so we said, well, maybe we can go back to the clinic and try again. Let's try a second time to see if we can help our patients with glioblastoma. And this time, there wasn't as funding available from the company, but the company said we could give you drugs. And because we couldn't get funding from the company, we had to find other sources of funding. And to do that, we went to the ABTC. It's called the Adult Brain Tumor Consortium. It's actually a brain tumor consortium funded by the National Cancer Institute. And we applied, and I had tremendous mentors. Xiaobu Yi is a world-class biostatistician, and Stuart Grossman is the head of neuro-oncology at Hopkins, and they both mentored me. And I remember sitting at the whiteboard, learning all about phase 1 trial designs, learning about maximum tolerated doses. It was a whole new language, but it was an incredible learning experience for me. Also, Dr. Patrick Wen and Bert Neighbors were the senior investigators of the Adult Brain Tumor Consortium, and they also mentored me through those years. And we were able to get a trial funded. And we were then able to move forward, taking the animal data and then now testing this idea again in patients. And with the trial, what we did was we gave patients who had recurrent glioblastoma either anti-LAG3 or anti-LAG3 and anti-PD-1. And this time around, what was interesting is we saw some patients having some interesting responses. Here on the left for this patient, you can see the patient on the top row had a glioblastoma, had it resected, and then he had recurrence. And then over time, there was an area of recurrent. He was then started on our drug, the anti-LAG3 and anti-PD-1. And you can see that around cycles 3, 4, and 5, it looked like the tumor was coming back, but indeed it did not. In fact, it then started to shrink away. This patient actually had a pseudo progression, and this patient is living past 50 months. And then we saw another patient who had actually multifocal disease, again, having responses. And what we found was that when we started looking at the survival curves of those patients getting the combination therapies, they did much better than the historical controls. And because I wanted to be a little bit more concise, we also ran an anti-LAG3 arm. And again, the anti-LAG3 arm was very similar to the historical controls. While it wasn't statistically significant for the anti-LAG3 arm, the curves did separate. But again, we had small numbers of patients. We were very encouraged by these findings. And then again, having a laboratory, we were able to go back to the laboratory, again, using the immunotherapy program. And we saw that in the responders, they had something called increased T cell clonality. That means they were T cells um, that had clones that were expanding, which suggested that they were um, activated in fighting cancer. And when you looked at some of the blood samples of the patients, you saw that the T cells in the responders were expanding. And when you did genetic analyses or RNA analysis, you could see that they actually had very distinct profiles. That is, the patients who responded had very distinct profiles. So with that promising data, now that it was only phase one, we wanted to move forward and go to a phase two trial because we wanted to test the question of efficacy, whether or not it really helped people. And to do that, we then had to go back to the National Cancer Institute, but then we went to the Alliance. And the Alliance is a large, is meant for phase two and phase three trials. And again, it's an NCI consortium. And Dr. Eva Galenis is the head of the Alliance. And with her support and mentorship, along with Carla Ballman and now someone named Susan Geyer, who are the lead biostatisticians, we designed a phase two clinical trial. And again, this was another group of mentors who taught me another set of skills. And in the Alliance Consortium, we created a trial where we're going to treat patients with recurrent glioblastoma with the combination of anti-LAG3 and anti-PD-1 or CCNU. It's not BCNU anymore, it's just CCNU. This is going to be a larger trial, a total of 170 patients, where we're going to try to assess survival and really look for efficacy. And that trial is underway, and we're excited. And again, this is another journey. The PD-1 journey took 10 years, but in this case, when we had an idea the PD-1 wasn't working a little earlier on, we were able to go back to the patients, identify a new target, then go into the lab, test it in our animal models, and then run a phase one trial, making sure that we figured out if the drug was safe and a recommended dose for the phase two clinical trial. And then now we have this trial open in the Alliance, and it's accruing very quickly. So we hope we'll have the answer now of whether or not we can help patients with this therapy. Now, this journey has been very instructive for me, and not only did I grow tremendously as a scientist, but I realized that you can make a lot of impact through each step in the journey. And as an example, when we went back and we were able to test, we were able to create a platform in my lab where we could test agents quickly. We realized that we could make impact for an impact for the field back then, at least. The data from Jing's preclinical studies was used as the basis for large clinical trials. Intellectual property was developed from this, and we were able to train a lot of great new scientists who are going to go out into the field and really hopefully amplify our efforts to find a cure against glioblastoma. And then I realized also that this could be a translational infrastructure. And if we can rapidly test drugs, we can then use that information to inform potential clinical trials. And as a result, these are some examples of studies that have come out of the laboratory and then were used as basis for multiple clinical trials. And uh, this is just a list of some of them. The other part, though, that I learned a lot about was leadership and leadership in the lab. And one of the things that I really focused on in the lab was creativity. And there's a really neat book called The Culture Code by by Daniel Coyle. And in that book, he talks about critical elements such as building a safe culture and culture of respect. But he also talks about another phenomenon called collisions. And the whole idea with collisions is that creativity arises from collisions. If you, for example, look at, in his book, he cites Pixar as an example. If you look at Pixar and the reason they were so successful, they had created an organizational structure in their company where people from story writing, post-production, pre-production, animation were always constantly interacting. They weren't in their own unique corners of the buildings. And when you had people constantly running into each other, they had creativity arose, and they were able to make a much better film. And in fact, when Pixar was bought out by Disney, and they brought the leaders from Pixar into Disney, one of the first things the leaders did in the Disney building was to take down the walls and create multiple opportunities for collisions. They recreated this situation where people were constantly bumping into each other from different departments. And as a result, the book cited that very big hits came out of the Disney studios once that was done. They were citing movies such as Frozen or Big Hero 6. Um, and so, as in leadership, as I learned that, I tried to recapitulate that in the labs. We bring in people from many different disciplines, and I try to do the least talking in my lab meetings. And I think, and I tell everybody that the brains of our research is truly the entire lab, and people feel safe to be able to talk and feel respected in giving their opinions. And as a result, a lot of the creativity that has come out and new ways of thinking or new targets that we identified are a result of that. And we do that with our collaborators as we work with other laboratories. And so when we look at the impact that we're made from the brain tumor immunotherapy program, as I mentioned before, I started with one technician and myself, and we were able to grow this. And if you can create a program where many people bump into each other from radiation oncology, medical oncology, neuropathology, neuroradiology, as well as our oncologists and the basic scientists, as well as my colleagues in neurosurgery, you can see where you could create a very vibrant culture of people that are committed to making a change and to be able to move quickly to help people. And we were also inclusive, and as a result, we were able to get the buy-in of many companies who wanted to try our infrastructure for us to test their reagents. And again, in hopes we're all in alignment of trying to make or try to help find a cure for glioblastoma. So as I had been at Hopkins for about 13 to 14 years, about 10 or 11 years into my journey, as we are going through this, um, I think that as you go through your journey, it's important to grow and you realize that you go through different phases in your life. And I showed this slide before, but I really do think it's a great analogy. If any of you have gone to the Taylor Swift concert, I have two daughters, so I took my daughters to the concert in LA. What was really neat was that when you started watching her concert, I didn't understand what she meant by the Eras Tour. In fact, I joke that I thought it was ERAS for residency matching for the first time I saw the title. It turns out that in her concert, she goes through each of the albums and plays different music from each of the albums, but she narrates where she was in her life. And you can see that she matured and changed over her life with each of the albums. And as a reflection of her life. And I think in your career, when you first start, now as a chair, as I think about how I mentor my faculty and the residents, I say in the beginning, it has to be era of self. It has to be about you. You have to make sure that you know and become know how to do good research. You know how to write a grant. You know how to um, operate or be a good surgeon. And in that first 7 years is what I say, because we're neurosurgeons, we have 7 year residencies. I just think in units of seven. I really encourage my faculty and early recruits to really focus on being good at what they do. You have to be in the trenches before you can understand how to magnify your effort. And then in the second era, it's the era of team, where you bring others in and you want to try to make an impact on the field, now not just out of your lab, but in groups. Um, as an example, that was working through the consortiums, working with many others to run large phase 3 clinical trials, or for some of my other faculty, maybe it's starting a company. Maybe it's making, bringing, working through large symposiums. but it's important because that's where you can make an impact. And then the third era is the era of giving back. And you have to realize that there are many people that mentored you over the years that gave their time and sometimes resources and their thoughts to you to help you grow. And it's important that you do that so that the field and more importantly, progress for our patients continues. And so in 2019, I was given the opportunity to look at the chair position at Stanford. And I was fortunate to have been given the chair position and come back to Stanford to lead a department. And at that time, we had about 55 um, people in the faculty. Um, uh, More than half were clinical neurosurgeons, but we had a very strong base. And to come back, um, it was the era of giving to serve. And I thought that if I could serve this group of people, that we could again make an impact and make a difference for our patients. And when I came back, we all met and we created a vision and mission, which is our vision in the department is to compassionately cure neurological disease while restoring function and well-being, to cure and restore. And then we had our mission to provide outstanding patient-centered care, to innovate through basic science, clinical translational science, and clinical science, and to develop the next generation of neurosurgeons, scientists, and leaders. And when we did this, I was given my charge, and it was my honor to serve my faculty and my residents to help them and enable them and support them to be able to carry out this mission and our vision. And everybody's in alignment to find a cure and restore function. And as an example, over the past 5 years, we've been able to recruit 14 new faculty into the department. Our residency has grown now to a 343 residency to be one of the larger residency programs. And our footprint and our ability to make an impact has grown. I mean, even with our basics, with our research mission, in addition to our incredible growth on the clinical side, our scientists are continuing to publish in high-tier journals and again make great contributions to society. So, in conclusion, as I mentioned before, I'm sorry the top figure got cut off, but uh, your career is a journey. And initially, when you think about your career, you think that there's a road ahead that you're going to walk. But in reality, there are many opportunities that will arise, and you'll get to choose forks in the road. But in the bottom picture there, all of those roads lead up and to a point where you can make an impact. And I think it's important that you always reassess, and you can always pivot. But moving forward, I think for me, it's been I feel very fortunate to have this career. And uh, um, I'm even more excited to be able to mentor the next generation to try to ensure that we do better for society. And the other thing that I always say is that this journey, remember, it's not something you do alone. And I showed pictures of my mentors who were incredibly supportive, and I wouldn't have been able to gotten to this point in life without their support and their generosity. And then, of course, I want to acknowledge that it's my family also. My parents came from South Korea in the 1950s when just after the Korean War ended. It wasn't a time in Korea where there was K-pop and K-dramas. It was a very poor country, and my parents came here knowing very little English to try to make a new life and memorize the majority of the dictionary just to be able to get into college. And my parents are the definition of resilience because when I was in high school, my dad got laid off, and he and my mom pivoted to owning a convenience store. And that is a lot of work. My parents worked 7 days a week from 6 a.m. to 10 p.m. And from them, I learned the skills of resilience, hard work, and being able to pivot. And again, my parents made great sacrifices to help me. But again, I wanted to acknowledge they also played an incredible role in supporting me. And my mom, she's always said that is the most important thing is to help people. And um, I feel driven to, and that's my motivation is ultimately to help people. So with that, I just want to conclude. I think that as we go through your life, it's a journey, but having vision is important of what you want to accomplish. And throughout your life, you have many chapters, but I always say try to see your story through the end. A negative answer can also be a chapter. I didn't talk about that as much today. And there'll be many forks in the road, and there's no one path that defines success. But this journey is very meaningful, and it's more meaningful as a team. And I think that there are eras in your life, and each one of those eras is I think, an incredible gift to have. And I'm sure that all of you in the crowd are going to make tremendous impact in the future. So with that, I want to thank you for your time.
Thank you so much for the wonderful talk. It was really, really inspiring. Really appreciate your time. If it's okay with you, we have a few questions to ask you, just to gain more out of your experience. One of the things we found on your lab website, you've spoken about the importance of a fine line between giving your mentees the freedom to explore and learn. Um, so my question was, where is the fine line, I guess, between exploration and learning, and when is the right time to intervene for your mentees so that they're not going the deep end in the wrong direction?
Well, that's a great question. I think it's individual. Um, some people, I believe that you need to tread water and struggle.
Hmm.
And if you don't tread water and struggle, you don't really learn because you may watch someone do let's say a flow cytometry 100 times, but the first time you do it and you're by yourself and there's a step where you're saying, did I need to put this reagent in first, or did I need to um, shake and spin I mean, do I need to invert the tube before I put into the machine? All those points are very important and critical, and it's important to learn. I mean, important to learn from. When I observe a mentee, though, to me, I think it's important that they understand the concepts and the bigger picture of why they're doing things, um, and not get lost in the details and struggles. Because I believe that if you understand the principles of why you're doing things, um, and then you struggle, then actually creativity can arise because you're not biased into always doing something the same way. But if you understand the principles, and I have found that more creativity comes out of that when you um, let people have the freedom to explore.
Thank you.
Dr. Lim, thank you very much for your presentation. I guess something that I wanted to ask you, a recurring theme that you mentioned is how the path forward may not be a straight line. You started on research very early and you achieved so much, achievements which culminated into the Abhijit Gua Award for your contributions. I guess my question is how has research helped you get past those forks in the road that you have found along the way?
Um, I think the forks in the road are, well, I think the research has helped me figure out forks in the road. Um, if you asked me in the beginning of my life or my career, I wanted to do immunotherapy. I was thinking I was going to do vaccines, and it was going to be all about vaccines, and I was going to develop a vaccine. But then having this clinical practice and seeing someone respond to the checkpoint inhibitors, I completely pivoted. And then when we were doing it, I mean, I had a very, as a starting scientist, you have a starting package and you don't have a ton of money in the beginning. But I remember I put all my chips in and said, this is something that's going to be important. And we were able to generate that data. But that was a moment where I chose a different road. I stopped going down the vaccine road. The vaccines are very important, don't get me wrong on that. But for me, this was something that I thought might be a very interesting and important point. And then now, as we've learned more about the tumor microenvironment, we know that it's not about T cells and it's more about what we think myeloid cells, cells such as macrophages. And we've now pivoted to that road. And when we studied macrophages, we realized metabolism is very important. And it turns out that your mitochondria and whether or not you go into oxidative phosphorylation drives the phenotype of these cells. They're all, I call them almost layers sometimes rather than forks in the road. But I would never have predicted I'd be studying the Krebs cycle again when I finished residency. But now we're um, very intimately studying that pathway. But it's, as I said before, it's been a really fulfilling journey for me because you get to go, you explore something, you ask a question, you get a different answer, and then you move. And even with my practice, while I do take care of all sorts of brain tumors, I ended up having more a special focus on posterior fossa tumors because I was exposed to posterior fossa tumors at one point and found myself loving it. Um, it's about experiences and trying things.
Thank you.
Thank you so much for being with us today, Dr. Lim. Following on that last question, how was your experience teaching impacted your clinical work and the way you connect with with your patients?
Um, so I think when I think about our clinical work, I still say patients come first, no matter what, because society is invested in you to take care of them. And research is very important to me, and I would say it's an important priority for me, but it's always been patients first. And when I was in medical school, the dean gave us a lecture on the very first day and said, as a physician, you have this privilege of being the first person someone sees in this world and the last person someone sees in this world. And one of the words that really stuck with me is the word privilege. And when you take care of patients with cancer, something like glioblastoma, it's towards that latter part where you have the privilege of being someone at their most critical time of need, not just them and their family. And so, um, you, I mean, for me, it's always been what can I do to try to either increase the survival of the patients or make sure that their quality of life remains high. And to me, that gives me a great sense of satisfaction and purpose.
Thank you, sir. There's a
Thank you.
question from the audience. Somebody is thanking you for the excellent talk, and actually, they've been fortunate to learn from your old mentor, Dr. Chuck Walter, at UNH. And in fact, they've attended your visiting lectures on glioma, trigeminal neuralgia treatments, and it was a very formative experience for this person. They're asking that as an early medical student, the advice they're receiving is that do not do basic science research. It's not worth pursuing because it takes years to publish. So what is what is your advice and thoughts on how to work a basic science interest into one's career, even as the residency application arms race incentivizes publication volume rather than short-term projects that may not be published?
Um, so I say that through this journey, one of the things that you appreciate is that life is short. And so you should always pursue doing something that interests you. If your heart is not in it, you're not going to be able to make progress and you're not going to be able to help. You're not going to be able to help humanity, which is the whole reason of doing science and medicine. Um, if you are interested in research, yes, it does take years, and it takes a long time, but it's an investment. And for the people that I've worked with in my lab, they love it and they love the science and they're going to make an impact. And it's going to be over years. I would say that over the time that I've mentored many students in my laboratory, almost all of them have been able to get into their field of choice, or they all have actually, and almost all of them have got their top choices, and some haven't, some didn't even publish by the time they applied. Um, and that's because I think, but they were able to demonstrate that they were a true expert in what they did. Um, and so I think if you really find science or you find a passion for it, it'll work out. And I always say it's not like you can't do some clinical papers. Many of my students wrote a few clinical papers while they were on service or while they're in their research years with me. They've also written some review papers. I feel that it's my job as a mentor to try to help them. And my students have been able to be productive in that respect.
Thank you, Dr. Lim. So we have a question from Carlota, who's a medical student in Italy, currently doing rotations here. She says that your sharing your journey through the lens of eras was very interesting to her. As someone who is navigating the early stages of eras, what do you believe was the most defining choice or habits that you developed in your first era, like she her doing rotation, that help set the foundation for everything that came after?
Well, I think what's important is that you, first of all, find meaning in what you're doing. There's many great fields in medicine to be in, and once you find, if you can find meaning in it, then your heart will be in it. Um, Second thing is that I tell people sometimes I think people think that you have to have a paper, and that's the objective of all their research years. Um, the students that I mentor, I say we have to find an answer to a question. And a negative answer is just as important as a positive answer because um, if you don't ask that question, or somebody else might ask that question in the future, and having a negative answer will be important because people can build upon that. And what I always try to emphasize in my lab, and I tell my students, is having a negative answer is just as important as a positive answer. And that's to me, I know it's idealistic, but that's how you live, that's how you have your journey in life and um, and for your journey and career. And if you're really doing that to try to figure out an answer, whether it's positive or negative, then you may or may not realize that you're learning important skills, whether it's something simple as in learning research techniques like flow cytometry, or learning about scientific techniques, or learning how to read papers. Those are all skills that will help you in the future as to build upon them so that someday maybe you'll be able to speak the language of science when there's going to be new technologies that you've never heard about, or when you get to a point where you mentor others because you've been in that process. But going through the process is more important than sometimes the end result, I think, or I believe that for the early part of your self journey.
Yeah, thank you so much. All right, let's see. So the next question we have, you've, as the chair of neurosurgery, as a having your own lab, having a clinical practice, you wear multiple hats. You're probably extremely busy, and I can only imagine it being overwhelming. What strategies have you adopted over this time to be able to multitask and manage your workload? And what advice do you have for medical students and residents who often feel overwhelmed with just, well, the amount of work they have?
Well, I mean, I think it's different when you're a student, um, or when you're in your early stages. It's usually several single tasks, and you need to focus on it. It's just a long, I call it's just a very long journey on whatever you need to do, whether it's your research project, whether it's getting through pathophysiology, whether it's studying for the steps. It's something you need to focus on. But at this point in my role and what I do, it's hard to be a micromanager in everything. And so what I've learned is that you have to have teams. And I think, as I said, that second era of learning how to lead effective teams is important. Um, and as a result, I mean, I think that I have incredible people on my leadership team here at Stanford who, uh, for example, are very effective in the clinical operations or faculty affairs. And then as my lab has matured, I've been able to recruit great people and form collaborations with others. And as a result, and again, it's a lab, the lab is very important to me. Um, you get to magnify your efforts. I think it's important that um, with the team, I try to recognize and acknowledge the people that are leading the efforts and try to help promote their careers. And so it's a little bit less about me, but about trying to mentor, I think, many maturing scientists that are coming out. But again, it's a it's learning to lead, it's learning to delegate, it's learning to create an effective team to be able to do what you do. I mean, to be able to carry out this job today.
And Dr. Lim, I guess also in the context of leadership and dealing with teams, one thing that I would like to ask you is that it seems like the different social dynamics across generations are something we talk about constantly nowadays, especially in relation to work and work-life balance. Have those changes had any impact on how you interact with your residents and attendings throughout your career?
I think it's important to recognize. So first part is setting the culture of respect and a safe culture so that people can have conversations. People are from different generations, but if you don't create an environment where people can talk and express um, differences in opinion, that's where problems and conflicts arise. And in fact, um, it's a very important part of our culture. We even create a video now for our incoming people talking about our expected norms for how we provide feedback to each other. The second part, I think that the second part is I think having a clear North Star. As you remember, I talked about having a vision and mission. If we all agree upon the vision and mission in our department, which is to cure and restore, you create alignment and we all are working towards a common goal. And again, I think that that helps set the tone and attracts the people that you want on your team to be there. If they know what the where the ship is sailing to. And the third is, as part of what I've learned through leadership, is that we created what we call values. And we have values in our department, values such as integrity, innovation, excellence, which is an expectation to be the best in what we do, mentorship, diversity. We have several norms that we've all, again, in our retreat, come upon and agreed upon. And those are important. I stress that in our department, and people understand that. And when you create those shared values, as well as having a common goal, that often brings people together to work together. And I mean, it doesn't always work, and it sometimes sounds idealistic, but it's been very intentional to do that.
That makes sense. Thank you, sir.
Yeah, thank you. How should students approach leadership early on to build the basics for leadership later in their careers? Because I think this is very important as well.
I think leadership and thinking about leadership is something one should start early. Um, And what I think about when you think about life, you are actually exposed to a lot of leadership. And I think becoming a good leader is actually coming from being a good observer. Um, if you look around your life every day, you could watch, for example, when you watch sports, it's a microcosm of leadership. You hear about championship teams and you hear about really great teams that fall apart, and it's because of leadership. You can look at great institutions and you can read about leadership. You can, I mean, if you read a book on Navy SEALs, there's incredible depth on leadership. The government spends tons of time on instilling leadership skills. It's all around you, and it's about learning. I, when I mentor people around us and even students, I say to them, I ask questions about you could watch you can watch an interaction happen, and you can ask people questions and say, well, what do you think about that interaction that happened? Do you think there was communication? Do you think the breakdown was on different values? Or when something great happens, if a team wins a championship, you can say, well, what is it that brought them to great heights? And I think it starts with that. There are always formal mechanisms you could do. Of course, there's courses. As an example, getting an MBA, I think leadership skills are a very core component of that. In our residency, we have tried to incorporate leadership into our curriculum for our residents. Dr. Odette Harris has them going to something called the Aspen Institute. I meet with our chiefs I try to meet with our chiefs every month. In fact, I get them, we go over a leadership book. We talk about learning moments because our residents are leaders when they are in the hospital and they're taking call by themselves, or when they're chief residents. Life is rich in terms of examples, and I think part of it is observation.
Thank you so much, Dr. Lim. We're coming close to the end of our webinar, and we know we've talked a lot about mentorship. And just to sum it all up for you, what is your personal philosophy or mantra when it comes to mentorship?
I think in terms of mentorship, it's first of all, it's giving, so that it's giving of yourself to try to help the next person. And hopefully you see that helping that one person will make an impact in helping many others. Second is to be reliable. I think it's important that you can be someone that they can turn to and be there throughout their moments in their journey. And I think the last part is, I think what I would probably say, being, I guess, the person that you could, I guess it's earning someone's trust. To me, it's important that you earn the trust of the mentee that you uh, um, are taking under your wing.
Well, thank you so much for this. To everyone in the audience, thank you for showing up today. Thank you for staying curious, and thank you for investing in your growth. And on behalf of all of us at Med School Mentor and all the audience, a heartfelt thank you to Dr. Lim for sharing not just your expertise, but your wisdom, your leadership, and your heart with all of us today. Let's just continue to build a community where we lift each other up, ask bold questions, and lead with courage and compassion. Thank you so much, Dr. Lim. Thank you, everyone.
Thank you so
Thank you.
much.
Thank you.
Thank you.